going with our health and housing panel. Thank you.
All right, can you guys hear me okay?
Sounds good.
All right. All right, well, we have a very packed housing and healthcare intersection for you guys. It was challenging to get this trimmed down enough because we have so much information that we want to share. And we originally had, I think, 3 sessions planned for the in-person conference, and we're trying to bring as much of that information in a short 1-hour session. So I'm going to keep the introductions to panelists pretty brief. You can see greater details about each of the panelists in the program. So Traci Clark is joining us from the Department of Public Health and Human Services with the Senior and Long-Term Care Division. Zoe Barnard is with the Department of Public Health and Human Services Addictive and Mental Disorders Division. She's the administrator. Ted Madden is joining us from the Montana Healthcare Foundation. And Brandon Bridge is with the Bureau of Business and Economic Research with the University of Montana. So I want to thank all of them for their efforts and in joining the panel today. And I'm going to turn it over to Traci Clark to get us kicked off.
Thank you, Cheryl. Can we go to the next slide, please? Everyone on this call today knows and understands that safe and affordable housing is an essential component of improved health and reduced use of healthcare services. So no surprises that health and housing is a crucial intersection for the people that we serve. And in 2015, the Centers for Medicare and Medicaid Services provided guidance to states saying that we could provide those housing-related activities and services under Medicaid. And lots of states across the nation are figuring out that policy fix for how to do that and reimburse for those supportive housing services. And when I say supportive housing services, I mean things like pre-tenancy services, for example, helping an individual fill out an application or do a housing search, doing an assessment to determine what their preferences are around housing and what kinds of barriers they might have in accessing housing. Pre-tenancy could also include identifying the resources needed to make a move into a unit house, and also the move-in related activities. So those are just some examples of pre-tenancy services that could be covered. And tenancy sustaining services are those things that help a person maintain their housing. So whether that's managing challenging behaviors or learning how to communicate well with your landlord and other tenants, pay bills on time, all those sorts of things are pre-tenancy sustaining services. So I use those terms interchangeably with the term supportive housing services. And Montana is really coming together collectively to examine what the possibilities might be for Medicaid policy to provide some coverage for those housing-related activities and services. Cheryl, next slide, please. Last spring, Montana was successful in applying for and receiving technical assistance through the Center for Medicaid and Medicare's Innovation Accelerator Program. And that's a mouthful. I'm going to call that IAP from here on out. You can see from this screen, what I want to highlight is the complexities when a state is considering new policy development around health and housing, that it takes a lot of different entities to accomplish that. And this slide demonstrates who is at the federal level kind of driving this policy change, right? We've got IBM Watson Health, the Technical Assistance Collaborative, the Corporation for Supportive Housing, Center for Healthcare Strategies, the Centers for Medicare and Medicaid Services that has offered this IAP technical support opportunity, the Department of Housing and Urban Development, the Office of the Assistant Secretary for Planning and Evaluation, SAMHSA, the Substance Abuse and Mental Health Services Administration, and then the U.S. Interagency Council on Homelessness. And to say that it's complex at a federal level also demonstrates how complex those partnerships are at the state level to implement these sorts of policy changes. Cheryl, next slide. This slide, the bright colors let folks know who has which states have participated so far across the nation in these IAP technical assistance opportunities. And these have been taking place since 2014. There have already been 2 cohorts ahead of us. Montana is coming in as the 3rd cohort. And those other states have had the opportunity to do extensive engagement, stakeholder activities, and spend time building out what an action plan might look like to accomplish this policy change for supportive housing services. Montana's coming in a little later in 2019, so we're doing a kind of a fast action of all 3 of those things: engagement, action planning, and the development of some of these Medicaid housing supportive services. Next slide. Our cohort that we've joined includes Maine and North Dakota and Virginia, as well as Montana. And our technical support started last May of 2020, and it's been extended twice, and it's scheduled to go through August of 2020 this year. Next slide. This slide highlights what some of the collective states' goals have been through their technical assistance opportunities. Things like increasing our housing networks and developing those new housing-related services or supportive housing services, to better leverage the Montana or the Medicaid long-term supports and services, and better understand those Medicaid funding streams that could help us develop the policies around supportive housing services. Goals also seek to expand and strengthen partnerships between housing providers and supportive service providers. We're also taking a look at what our data analytic capacities are and how we can best use data to inform the decisions we make about how to develop those policies and what people to serve with the supportive housing services. And to also obtain new benefit approval for supportive housing services in Medicaid, whether that be through the programs that already exist or whether it to be to take a look at a brand new program exclusive for supportive housing services. Next slide. Some of the common beneficiaries or target populations that other states have looked at to receive these supportive housing services include people who are homeless currently or at risk of becoming homeless, individuals that transition from institutional settings or have a risk of entering those institutions, folks with high utilization costs of Medicaid health services, people with mental health or mental illness or substance use disorder, folks who are aging and have physical disabilities, and people with complex needs. Next slide. In Montana, we structured our goals around these 2 things. We really want to identify and understand the options within our current Medicaid programs where we could add or strengthen pre-tenancy and tenancy sustaining services, those supportive housing services as a Medicaid benefit, or look at a new program around supportive housing services. We also want to identify who would receive the services and how to secure the housing resources for those individuals that might receive that supportive housing services benefit through Medicaid. Next slide. In January, we formed 3 internal work groups, and those work groups in turn engaged a larger network of stakeholders, and you'll hear more about that as we talk. I'm going to present about a high-level synopsis of what the target population and data work group focus was, and I was a co-lead on that work group with Shay Vogel, who's with our Medicaid System Support Program in the Department of Public Health and Human Services. We'll hear from Ted Madden with the Montana Healthcare Foundation, who was the lead of the services work group, and we're also going to hear from Cheryl Cohen, who was the lead of the housing work group. And really the purpose of those work groups was to dig a little bit deeper into the information we know and what we still need to know, and how can we put that together to develop some recommendations for how Montana might pursue a supportive housing services program in Medicaid, and to garner the support and resources that we need to develop that new benefit. Next slide, Cheryl. Let's keep going. I'm going to talk about the desired outcomes of the target population data work group. We knew going into this work, especially through some reports that were commissioned by the Montana Healthcare Foundation through the Corporation of Supportive Housing, that we have some gaps in supportive housing services currently in our Montana Medicaid programs. And we wanted to take a look and build a case for how to use data that supports the creation of a broad-based supportive housing benefit in Medicaid, and to also look at how to make improvements within those existing Medicaid programs. Next slide. Just to summarize what we learned, within the Department of Public Health and Human Services, information isn't readily collected or available about which Medicaid beneficiaries have a housing need. So we know we have some work to do around asking those questions and collecting that sort of data. But we also learned that there are some things in the works. Our Medicaid System Support Program staff is doing some work around social determinants of health screenings and how might we incorporate them into assessment processes. And housing could certainly be one of those areas where we collect more information about housing need from our Medicaid beneficiaries. So we've got some work to do about learning who our target population is, but we've also got some other data through our partners that work in the homeless network, and we can put together some of that information. The Corporation for Supportive Housing included that in its reports back to the Department of Health and Human Services last spring. So there's a few different ways to poke at who might a target population be in Montana. And we can look at what other states have done who have successfully garnered a new policy or Medicaid benefit around supportive housing services. And specifically, they've looked at the homeless and chronically homeless population. They've targeted high-cost utilizers of services, frequent users of services, folks with chronic illnesses, mental illness, behavioral health issues, and substance use disorders. So states who've been successful in garnering new policy for supportive housing services have targeted those populations in particular. Another consideration that we might look at is within our existing Medicaid programs that serve specific populations. You have to meet certain eligibility requirements to access those different Medicaid programs. Could we make changes within those programs to successfully provide supportive housing services? And Zoe Barnard is going to talk next about what the Addictive and Mental Disorders Division is doing when they are looking at their internal programs for making improvements. And then the third possibility is Montana really does have some great data analytic capacities. There is the possibility that we could develop an accurate algorithm that helps us identify individuals with high housing instability. And those risk scores could give us some information about target populations. So some exciting stuff that Montana is working on, and this technical assistance opportunity required the Department of Public Health and Human Services to have a partnership with the Department of Commerce Montana Housing Program, and we're just excited to be here and to be able to explore what the possibilities are. Zoe, I'm going to turn this over to you as you talk to folks about what the Addictive and Mental Disorders Division is doing within their current programs.
Hi everybody, you should be able to hear me. I'm trying to start my video here so that you can see me. Logan, I can't get my video to start. I think you've made it. There we go. Thank you very much. Hi everybody. Next slide, please. So as Traci noted, I work for Medicaid. I work directly for the Medicaid director within DPHHS. And historically, the Addictive and Mental Disorders Division was really not a solely Medicaid division, and it's still not. But we're a lot more Medicaid than we used to be thanks to Medicaid expansion. I would say that prior to 2016, it was kind of a patchwork of different funding sources to try to get members what they needed, and we really focused mostly on putting our finger in the dam, would be the metaphor, or really just trying to serve the most acute needs of members. And that's because we were using general fund and some other funding sources that were limited. Now that we have Medicaid, a lot more people in Montana are eligible for substance use and mental health benefits. And that is because if you think about it, people who are 18 to 64 with a substance use disorder or a mental illness would fall into the category of those are the people who need help. So I wanted to note here that within Medicaid, we can help a member find and sustain safe housing. What Medicaid cannot do, is federally disallowed from doing, is paying for room and board. So a lot of times when we talk about the housing conversation with Medicaid, we talk about doing things like having care coordination that helps members fill out their housing forms. And so in having this discussion and receiving the technical assistance, we had many of the services in place already. But what we needed to do was think more broadly in terms of our guides for what those services could do. Next slide, please. So we're thinking about our care coordination, case management, and bundled services in terms of the kinds of tenancy support that can be part of those services. One of the programs that we have for adults with severe and disabling mental illness is called Assertive Community Treatment. And this is a national evidence-based model that Montana has had for a long time. But we've been in the process of collaborating with providers to really expand and improve the level of service in this particular bundled service. One of the things that we are going to be requiring as of July 1st is an assessment, a complete assessment of social determinants of health for the members. And then we specifically ask that as part of the bundled service, housing support is provided. So there's actually a tenancy specialist who will be on the ACT team from here on out. In addition to that, we've added a level of PACT called Intensive PACT or INPACT for those who are at very high risk, perhaps mostly for those who are just getting out of an institution, who really, or who are referred directly by the department, who really need to have a short-term placement in an intensive group home as they get connected to the Assertive Community Treatment team. And then that time in the group home is really used to figure out what social supports are necessary. Next slide, please. We've also really started to think about tenancy support services in our home and community-based waivers. So this is an extreme simplification, but in brief, Medicaid waivers are a community-based alternative to institutionalization, like a nursing home. And all of our housing waiver services include case management and crisis response, as well as long-term services and supports. What we've really been thinking about in our SDMI waiver is what services need to be in there to support a member's staying in housing long-term. In other words, to provide the kind of supportive living environment that will allow someone to maintain their housing. And that can include behavioral support services that help someone deal with the symptomology associated with an SDMI to help maintain housing, as well as having a case manager that can help them maintain housing through forms. And then many of our waiver members also if they need it, have a payee service, and some help with financial management. Thank you very much. Next slide. And I'm going to turn it over to the next person on the panel.
Hello, this is Cheryl. I'm going to present on the housing work group. So pardon me while I moderate an advanced slide deck. I think many of the audience for our Housing Partnership Conference, I'll be speaking to the choir a little bit, but hopefully the information is kind of aligned with where you're seeing we may need to go as a community. So the housing work group included over 15 members from a variety of organizations, including local public housing authorities, tribal housing authorities, developers, HDRCs, as well as Department of Commerce, Montana Housing, and the Community Development Division, and Department of Public Health and Human Services. So our primary scope of work was to map our existing housing program resources, including capital and operating assistance fund sources for affordable development, and to identify and pursue housing opportunities that can be connected to tenancy services or those receiving a Medicaid benefit. And in addition to just looking at the resources, we also wanted to review the policies with respect to those resources for the target populations that Traci and Zoe have been talking about, including persons experiencing homelessness, those exiting institutions, or those that are unstably housed, as well as frequent or high cost utilizers of high cost services. So one of the tools that the IAP technical assistance provided was a housing resource and policy matrix that our team worked together to complete. So it mapped our resources from, as I mentioned, capital fund sources, as well as operating and rental assistance programs. So this included housing choice voucher and project-based rental assistance, the HUD Veteran Affairs Supportive Housing Program, mainstream vouchers, the 811 project rental assistance program for persons with disabilities, non-elderly persons with disabilities. So kind of the whole gamut of rental assistance resources that are administered both at the state level as well as local public housing authorities. We looked at housing credits, the Multifamily Coal Trust Homes Program, CDBG and Housing Trust Fund, the Home Fund, Emergency Solutions Grant, and USDA Rural Development. So some overarching themes from the housing work group, and here's where I'll be preaching to the choir a little bit. I think we're all having the awareness of a lack of resources. So this includes additional funding to leverage soft resources and grants, and a need for an increase in rental and operating subsidies to help keep rents affordable. More homes that are accessible and meet quality standards. And then funding for the supportive services to help retain residents that may need those ongoing tenancy sustaining services. The other theme was around system gaps. So this was demonstrated when we've worked on various grant applications over the last year or so, and in looking at the service delivery across the state, it's fairly patchwork. Different localities administer services in a slightly different way, and some have more robust services than others. And so that makes it difficult, particularly if we're pursuing an application for, say, a housing urban development at the state level, to be able to attest to the service delivery that will happen throughout the entire state, given the variety of what we're seeing. And there's also the difficulty in providing services in rural and frontier areas. So I recall I was at a meeting some time ago with Public Housing Authority executive directors, and there was the conversation about, rural means, and maybe there was another state there and they were talking about rural, but that really sounded like suburbia. And we're talking about frontier, where there's, hours of drive between locations and between availability of services. So a couple of other themes, communication, sharing, and complexity. So we have fund sources that are administered by multiple departments, multiple divisions at the state and local level. And so that variety of the administration can create different timelines and applications, or slightly different requirements or requirements that maybe don't align between different fund sources. And those different fund sources may be needed to work together in order to develop additional affordable housing. There's also, just as you know, a lot of in-depth federal fund source requirements and inconsistencies between fund sources at the federal level, and challenges specific to rural development scenarios. Our housing work group was joined by a graduate student from MSU who worked to do some research on consolidated plans from 3 neighboring states and put together a little white paper for the housing work group. And what it looked at was a couple of themes. Some of the neighboring states that were reviewed, Wyoming, North Dakota, there may have been more explicit prioritization for funding for permanent supportive housing properties, or more explicit adoption of a housing first model. So due to the COVID emergency, there were several next steps that we needed to put on hold. That included telephone surveys with tribal housing authorities to make sure that we were capturing their resources and system gap needs. Formalizing public housing authority survey and input, and the consolidated plan focus groups and public input that will be happening in the future. And we'd like to reconvene our housing work group to really assess the findings from that consolidated 3-state scan and the entire matrix that we put together to assess those findings and elevate potential recommendations. So we're at a very preliminary stage of looking at policy considerations for leadership. And these are things that will need to be elevated up as the Department of Public Health and Human Services, as well as the Department of Commerce, discusses what the options may be with our leadership and needing to bring in data to inform decision making. So these are some themes that we could bring for consideration for our leadership. That includes assessing or adopting or prioritizing projects with services. So like permanent supportive housing and housing first models. So housing first is a model that really is a low barrier. It doesn't have pre-assumed requirements for residents to move in. So there may not be any requirements for clean and sober. There's lease requirements. And so it's the perspective that in order for folks to really be able to work on some of the challenges in their life, they need to have housing first. We could investigate a shift of tenant-based voucher resources to project-based vouchers with affordable housing properties. We could continue to collaborate on applications for additional resources. So the state and DPHHS Commerce collaborated on a successful application to Housing and Urban Development for additional mainstream vouchers that serve non-elderly disabled persons. And we can increase collaboration on project application processes and maybe ongoing compliance monitoring to kind of reduce burden or streamline processes. So those are all things that we can look at as far as funding agencies go. There was also a couple considerations for the continuum of care. They've already been working very diligently to improve data collection and performance, which could help increase their competitiveness for additional funding for continuum of care grants, and to assess their application and awards process in ways that could increase transparency and target high needs populations. And so with that, I'm going to turn it over to Ted Madden for an overview of the services work group.
Ted Madden with the Montana Healthcare Foundation. And I know many in the room, or I should say in Zoom land, have been working on a lot of the different services and housing work that the Montana Healthcare Foundation has been involved with over the last couple of years. So thank you for all your work on the ground. And you might be asking, why is a healthcare foundation at a housing conference? A few years ago, we really started looking at the social determinants of health and knowing that unless someone's housed and stably housed, they can't be healthy, and they won't stay housed unless they have access to health services and the needed services they have. So it's been great to work with the Department of Health and Human Services, Cheryl Cohen and the Department of Housing, AMDD, to really look at that connection between housing and healthcare, knowing that they're intricately related to someone's well-being. Next slide, please. So the service work group, the foundation really got involved with the work of the IAP before the IAP was started, when we did an analysis, or we funded an analysis with Corporation for Supportive Housing to look at Medicaid and department benefits around housing, and where some of those gaps are. It was called a crosswalk. And also look at, you know, the utilizers of Medicaid that also are on the HMIS system, and where that correlation is, and if there could be some deeper dives into the department and Medicaid benefits that would really result in better coordination of housing support for Medicaid clients and DPHHS clients, and also provide better services to those clients through housing support. So I know, so we took a deeper dive into that, and our technical assistance provider helped really look at each department in Medicaid, and looked at where they have a good alignment or alignment with tenancy and other support of housing services. And then we also, as part of our Housing is Healthcare initiative with the foundation, with Butte, Great Falls, and Missoula, who are some of our early communities involved with that project, we really took a detailed analysis and mapped out who in those communities are providing tenancy, pre-tenancy, and other tenancy case management services to folks in those communities, either that are on the coordinated entry list or other just general inventory of services across the housing and healthcare provider spectrum. And then the service work group also had local discussions with local providers and DPHHS representatives at monthly meetings. I want to give a special shout out to Bob Buzzes, who's not on the panel, but with all three of the work groups, he provided some great input. And I know with the HMIS system and his the work with the COC, they've been great partners as well. Next slide, please. So what the crosswalk and the deeper dive across departments really sought to understand was what programs have significant alignment that could make administrative changes in the short term. And we heard from Zoe about AMDD and what they're proposing to do to really offer those universal services, and know that housing and tenancy support is an important function of any healthcare intervention. And then, do any programs align with services, but do not align with target populations needing tenancy support? So is there a need for a broader base benefit throughout Medicaid to fill those holes where they may be going into different programs or different channels to access benefits? And then what services and programs have least alignment that would be as new benefit? Next slide. So the housing support services, Traci talked about this a little bit, but really that pre-tenancy of doing the outreach and in-reach services, really assessing, ensuring housing units is safe, developing housing support crisis plans, and then moving on to the housing stabilization and tenancy sustaining. Really that early identification of behaviors that would, you know, to make them successful tenants and work with landlords, eviction prevention, planning and coordination, really in the advocacy and linkage with community resources to prevent eviction, and that continued training on tenancy and household management. And then the housing focused service coordination really focuses on either discharge planning or making sure they're transitioning and being stably housed. And that work blends into potentially reaching out to their healthcare providers, primary care providers, substance use providers, mental health providers, other job services, things like that, to make them successful as a tenant. Next slide, please. So this looks intimidating. Don't expect to read all the fine print on this, but this was just a snapshot of looking at what CSH did in the service work group, of really looking at current programs throughout the Medicaid department and DPHHS, the Department of Health and Human Services, of where are those current pre-tenancy, housing stabilization, and housing-focused service coordination services currently being offered. As you can see, some programs currently offer a pretty high fidelity to that array of services. Some offer some, a mix of that, and others aren't aligned. And so it was really helpful information to know what programs we could look at for some immediate kind of alignment, for instance, AMDD. Also, there's other programs that we want to take a deeper dive into, like FQHC and patient-centered medical homes, or hospitals that work with folks in their care coordination efforts. Next slide, please. And as you can see, this is the problem of a lot of different pockets that currently fund sources for the supportive housing services, for those pre-tenancy housing stabilization and other services. So some of it does come from Medicaid, some come from grants, other come from state general funds. And so trying to align that as well to see really where those costs are and where that alignment would benefit both in cost savings and more robust service product or package across provider networks and departments. Great. I'm going to transition a little bit because that service work group does overlap with a lot of the work individuals in the conference are involved with, is the current Housing is Healthcare initiative sponsored by the Montana Healthcare Foundation. So we have Billings and Kalispell just joined as our planning communities for this year. And as you know, Missoula, Butte, Great Falls, Helena, and Bozeman have been working at this for a few years. So I'm just going to do a quicker overview of really what that process looks like. And with their planning grants, really this is identifying really a target population, what we call the FUSE population, the frequent user system engagement. So it's a framework to really identify who those folks are in your communities that are circulating through chronic homeless issues, emergency rooms, civic emergency services, jails, and tying them into your coordinated entry system and other systems to really intervene and develop a community plan to intervene with those folks. So it's really bridging that gap between maybe a housing provider that's doing a lot of the upfront housing work and housing navigation to the healthcare community that has other resources or can make an impact on these patients' lives. And then also identifying those systems and figuring out what gaps are and making sure everyone's at the table, working on common definitions and a common language and common systems to be able to work with these folks. And then that quickly, after a year or so, and some communities are, Billings and Kalispell are ahead of the game. They've been working on this for years with the coordinated entry systems and other systems, really go into a kind of a development phase of really developing that toolkit and that framework to really implement aligning the housing unit supply through vouchers and other support. It could be even short-term COVID dollars, things like that. And really with that tenancy case management. So getting someone housed, but making sure that tenancy case management, those pre-tenancy and all those different supports are aligned and wrapped in for the most vulnerable and high impact individuals. Both FUSE folks, what we call FUSE folks, and also other folks on the coordinated entry list. And then really the third part of that really is developing the framework and the model that's sustainable and you can communicate and track your impact with this. So it's really developing the playbook for the community. Some communities do that across their housing and healthcare networks, and others use some technical assistance or a project coordinator to do that. Next slide, please. And again, that tenancy support services, it's so encouraging through the IAP and with the work with the department and all the housing providers that are currently doing that work, is really where we see some funding alignment to be and some integration and to make sure that those services are done in a seamless and to fidelity. Because what we found through our community work in working and kind of mapping out those services in Butte, Great Falls, and Missoula is that everyone does it a little bit differently. In some communities, one organization is at the lead and others are support, and that might be the exact opposite in other communities. So it's really community specific on what resources are currently in place. So really trying to map it out where you could have more of a seamless and kind of an informed network of those tenancy support services, and working with our partners at the department to make sure that those funding sources align with those current providers. And then the other things we've seen in those local communities is that the green squares there is that the tenancy and the pre-tenancy and that housing stabilization services are huge. But for a lot of these populations, that housing navigator or those folks, they need someone to hand them off to seamlessly to come on to a care coordination team, a PACT team, or some other more intensive case management that could provide that primary care, that substance use, mental health services. And right now we're finding that that alignment happens pretty well with certain diagnoses like the SDMI or a certain population, veterans populations, for example, or others. But it's trying to do it, that coordination and that care for the folks that need those tenancy support services, but also to bridge them directly and have that coordination to hand them off and to maintain communication and a system across all those different other types of services that will help keep folks housed and keep them healthy. So we can't answer questions right now, but we will at the end. And so we just threw a lot of information. So I'm going to turn it over to Brandon. So the Montana Healthcare Foundation recently commissioned a grant to BBER at the University of Montana. And a shout out to Michael O'Neill. He's helped guide this process in terms of really trying to inform local stakeholders and other statewide stakeholders in the state about what the status of supportive housing, or both affordable housing and affordable housing stock, and what other states are doing to finance new development and the maintenance of those units. And so I'll turn it over to Brandon to explain the study a little bit. And I know we're asking a lot of the right questions right now, and we're getting to some good solutions and answers. Brandon?
Okay, thanks, Ted. Okay, so as Ted said, Montana Healthcare Foundation recently gave our Bureau a grant to research the state of affordable housing in Montana. Now, kind of the premise for this is that a lack of affordable housing leads to an increase in cost-burdened households, leads to an increase in homeless households, and all of these things lead to large impacts on health and well-being of both the individuals and the households. And as we know, that these situations impose costs not only on the household in question, but also on the communities, and particularly the public institutions that are supporting the communities, such as the schools and the hospitals and the criminal justice systems, etc. And a sticky part of this problem is that these costs seem to be increasing. They don't seem to be going away. The trend doesn't seem to be changing. So looking for a way to address this problem, looking for a way to reduce these costs going forward is going to be a continuously relatively urgent problem. Now, one proposal to address this problem or this situation is to explore the use of state and federal funding to both develop new affordable housing units, as well as to rehabilitate and revitalize the existing stock of structures and affordable housing units. Next slide. So what we're doing for the study with the grant from the Montana Healthcare Foundation is a little bit kind of threefold. So first of all, there's a lot of different federal programs, there's a lot of different state programs, public finance programs that exist to encourage and support housing affordability. Now, navigating all of these programs and the ins and outs can be a little bit challenging and daunting. So kind of the first priority of the study is to create kind of a full repository, a summarization, and a cataloging of all the different federal and state public finance programs that exist currently in Montana, such as the programs that are currently in existence, how they're being utilized, which which programs are being fully utilized, which ones are being potentially underutilized, and what some of the concerns are there. And then kind of a component to that piece is to summarize the other state public finance programs that are supportive of supportive of affordable housing that are existing in other states, but not necessarily existing in Montana. So maybe the programs that are existing in comparable states, what the impact of those programs seems to be, and a discussion of how those programs may be implemented in Montana and kind of what the anticipated effectiveness would be for that. Then the second kind of piece of this study is to create a more accessible database of all of this information. So a kind of a property level database that is more easily navigatable, that contains the properties, contains the subsidies, contains the different programs that are used, the ages of the structures, and something that's a navigable resource for people that are interested in these issues. And then lastly, the last part of the study is to use these different information sources to really kind of analyze the demand and the impact of affordable housing in kind of some of the primary population centers in Montana. So the last bullet point here on the slide, we're going to look specifically at Helena, Great Falls, Kalispell, Flathead County, Missoula, Billings, Bozeman, and Butte. And so those are the counties that we're going to do a deep dive into the situation, the affordable housing situation in those kind of more urbanized areas. Next slide, thanks. So for example, one focal point of this study is the issue of low-income housing tax credits. So just real briefly, what these are is this is a federal program where tax credits are awarded to developers of qualified rental projects. These programs are administered by state housing finance authorities. And what happens with these is that credits are provided developers, and they can either be used or they can be sold to investors to raise capital for real estate projects. And there's two types of credits. There's a 9% credit and a 4% credit. These are percentages of construction costs. If the project and the development project takes place and qualifies for these projects, then what happens is that percentage of the construction cost can be claimed as a tax credit each year for 10 years after the project is completed. Now the 9% credits are typically used for new construction, while the 4% credits are typically used for rehabilitation of existing structures and new construction, which is financed with tax-exempt bonds. Now, for the federal program, the allocation is based on population numbers to the states. And what we've seen is that many states and many federal dollars for the 4% credits have gone kind of unclaimed, meaning that a lot of developers are finding it more difficult to stay profitable with the 4% credit. So a lot of that is being kind of left on the table. Subsequently, many states have been implementing their own version of low-income housing tax credits so that they can help further leverage the 4% federal credits that are going unused. So this is currently taking place in 17 states. So 17, the brown states in the image there, have implemented their own state low-income housing tax credits. And by and large, the goal is to provide additional tax credits so that the federal 4% credits will be more profitable and more used, so that less federal dollars will go kind of unclaimed. So it's in place in 17 states. The yellow states are where it's been proposed. So it's been proposed, and these programs have been proposed in 6 additional states. And each program is a little bit different. One of the main benefits of these types of programs on a state level is that one of the main benefits discussed is that the tax credits, they're not claimable until the project is completed. And so the tax credits don't really start to impact the budget for a few years, 3 or 4 years, while the until the completion of the real estate development project. But in the meantime, they're used to incentivize development and construction activity, which generates economic activity. So that seems to be one of the more talked about benefits, is you create some short-term economic activity, and the tax credits don't kind of hit the balance sheet until the projects are completed. So next slide. One example of a Western state which has implemented their own low-income housing tax credit is Colorado. So this program in Colorado was kind of recently re-implemented in 2014, and they had their own selection criteria for projects that would qualify for the state credit. These are the bullet points listed here, the selection criteria. So it's targeted primarily for low-income households, defined as no more than 60% of the area median income. So they have some selection criteria that includes extended low-income use and home ownership options. A community revitalization plan is required, generally targeted at tenant population with special needs. So not only low-income housing, not only low-income households, but also senior households, disabled households. And part of the selection criteria is a subsidized housing waiting list. And what we've seen, next slide, is that this has directly leveraged more of the federal dollars that are available for the 4% credits in Colorado. So just as a snapshot, in 2017, just with the addition of the state credits, almost 1,300 housing units were directly supported with the state credits that, in conjunction with the federal credits. And that accounted for $168 million in new private sector investment, $11.3 million in federal 4% credits just in 2017. So those are dollars that would have been historically unclaimed without the state boost. And one study that estimated the economic impact of this program estimated just the 2017 economic impact for the state of Colorado to be over $500 million and over 3,000 jobs in the state. And aggregated since the renewal of the program in 2014, since then 4,263 housing units have been directly supported from this. $33 million of additional credits leverage from the federal government, and over $460 million of new private sector investment. A quick breakdown of the program in Colorado shows that on average, the residents of these new units, affordable units, are paying 61% below market averages in their areas. About 65% of these affordable housing units are being rented to households that have a female head of household. 16% of them are to senior households. And out of those that are not retired in these units, a lot of them, about 28%, come from the service industry, 10% from the professional service industry, 10% from kind of construction, production, operating industry. So it's provided more affordable housing for these kind of more vulnerable populations. Now, the next slide shows a little bit of a graphic of how this has taken place in Colorado. We can see that up until the year 2015, before the state program was implemented, the yellow bars on the bottom are the units that are taking advantage of the 9% tax credit. The blue bars are the 4%. And then we see that in 2015, after the program was re-implemented in 2014, the green bars are the new units that have been funded with the state 4% tax credit, and which has allowed the developers to also qualify for the federal 4% credit. And so that you could see that in 2015, 16, and 17, they've nearly doubled the amount of 4% credits that were being utilized in Colorado, which has resulted in over 4,000 additional housing units than would have been realized without the state program. So that's a little bit of a snapshot, and that's what the study is going to be doing, is cataloging a lot more of these examples of kind of comparable states and showing how this may or may not be effectively implemented here in Montana. And so for my last slide, I'm going to talk about kind of the database, the information that's included in that database, and how we're going to kind of use it. So in the current database on properties being with active subsidies, we have a lot of information on the type of property, the number and types of subsidies that are being used there, kind of what the unit attributes are, the target population, meaning if it's just low income, if it's disabled, if it's elderly, the type of population that's being targeted for the property, where the property is located, which programs are being utilized, how long they've been utilized, when the end dates of their utilization is for the programs, if it's a multifamily housing development, what the REACT scores are and what they've been the last few times they've been scored, what the age and the condition of the structure is, et cetera. So with this information, we're going to be able to make better inferences on kind of the right-hand bullet point list here in the slide. So we're going to try to be able to get to a better understanding of what the current demand is for affordable housing in these different urbanized populated regions in the state. With that, kind of what the gap is between the supply of affordable housing and the gap between the supply and the demand. So kind of the percentages or rough approximations of the target populations that are not being served by these affordable housing programs. And then also kind of a big one is what the needs are for rehabilitation by region. So one of the dangers to particularly the low-income housing tax credit program is after the 10 years, if the property is more valuable to just be resold on the private market rather than having the funds invested on rehabilitating it. If these properties then just go to the private market, then there's a significant portion of affordable housing units that go that are removed from the system, and so that it will make the situation worse for a lot of the households that are at risk. And then we're going to be able to look at who these households are that are at risk of being of losing these properties to the private market. And then also we're going to be able to look at the potential impact of increased affordable housing in Montana. So what the kind of to make inferences on what the economic impact would be and how many households would be impacted. So with that, those are the things that are going to be in the study, and I encourage anybody to keep an eye out for that for when it's going to be completed. And with that, I will pass it along. Thank you.
So I did tell you that it was a pretty packed session, and we're nearly at time. I want to thank all of the panelists. We do have 3 polling questions that we'd appreciate some feedback on. So Michelle, if you're able to queue up the poll questions for these. So the first is, which of the housing services are you most struggling with in your community? And so there's a list here. You can check 3 of your kind of top priorities. And the reason we're asking these poll questions is it's just another way for the Department of Commerce and the Department of Public Health and Human Services and the partners with us to really look at what might be the best benefits for us to pursue under Medicaid. Should I give a little bit more time or move on to the question?
A little, okay.
Okay. The next question is, which of the, in assuring individuals can maintain their housing in your community, which of the following are most needed? So education on tenant and landlord rights, eviction prevention, assistance in resolving disputes, assistance with housing recertification or training on tenancy and household management. So these are kind of the tenancy sustaining services that we've been talking about. And you can select 2. And the final question Which of the following service coordination activities are you struggling with in your community? So you can check 3. So this is kind of the care coordination component of service delivery. So it includes discharge planning, housing liaison, community integration, information referral, non-emergency transportation, on-call crisis support or intervention, and assistance accessing or identifying community supports providers, health and wellness, education, or peer support. So I think we're at just at 12:01, so I'm going to defer to NeighborWorks Montana whether or not we have time to take a few questions or if we need to respond to them in writing and provide after the fact.
I have noted all questions and we will respond to them on the website.
Yeah,
So we can
that sounds great, Katie. Thanks. And Cheryl, I think maybe we can at least respond to the timing on the housing study and the work being done by BBER so people know what to expect.
Sure. Can Ted or Brandon give a timeline for that study and when it might be available?
I did message Brandon about that and he said roughly July or August. So look for that then and we'll make sure that we can keep our website up year round. So we can put that there too.
Great. Well, I'm sorry we didn't have time to take questions in person, but I hope folks have good lunch and thanks so much for joining us for the health and housing intersection conversation.
Thanks, Cheryl. Thank you so much to the panel. There is an absolute ton of stuff going on and it's just really exciting to see all the intersections and the potential here. So thank you for sharing all of that. As Cheryl said, we are going to move to a lunch break now. It's a 30-minute break. We'll be back here at 12:30. Again, if you are going to be joining us for the next session and can stay logged into Zoom, we encourage you to do that just to cut down on any technology challenges. Before we go to the break, we did want to let you know that while we were disappointed to not be in person, we are trying to keep true to some of the core and normal elements that we provide during any given housing conference. So in that spirit, we are contributing a community give back donation. This year, those funds will be going to the Good Samaritan Hunt Housing Fund in Helena. We want to say thanks again to Wish Camper Development Partners for being our community give back sponsor this year. Good Samaritan in Helena began to award grants to help house the working poor in the greater Helena area. The fund is a hands-up approach to reduce homelessness and is being used to help men, women, and children from shelters and transitional housing move into more stable and permanent housing. By helping to pay a deposit and the first month's rent, the Hunt Housing Fund assures a positive start to a stable living situation. So if you are interested in learning more or donating yourself, we are posting the link to the Hunt Housing Fund in the chat. We are also continuing with our awards this year. We'll be doing awards at the end of the day today to recognize lenders, legislators, and leaders who have made incredible contributions to make homes affordable to all Montanans. We do hope you'll stay with us and that you'll join us for those awards. And to celebrate, we also will have some great raffle prizes for attendees that we'll be drawing at the end of the day. You don't have to be present to win, excuse me, but we hope you will.